Hello. Thank you to those that joined us on July 31st for OCH's Community-Based Workforce Convening. It was lovely to connect with you, and we appreciate you taking the time for collaboration during the busy summer season. I'm Miranda Berger, and I'm the Director of Programs for OCH, including Olympic Connect. One of my favorite parts about being in this role is the honor to work with you, the trusted helpers of our local communities. As a former care coordinator and someone whose family has been positively impacted by members of this workforce, I want to first say thank you. Your passion for helping others is the heart of this work. At our meeting on July 31st, we explored the value of our lived experiences. Around the room, we shared that our lived experiences mean we are resilient, compassionate, powerful, passionate, genuine, human, and so much more. We also learned more about Olympic Connect. We explored your top questions and started to build shared understanding. I'll highlight the themes from our discussions next. Over 2 decades of research demonstrates the negative impacts of adverse social conditions on health. Poverty, job insecurity, housing instability, food insecurity, lack of educational support, social isolation, and more have been shown to impact health. Recently, investments in housing, income support, nutrition, education, and care coordination are proving to be effective strategies to improve health and reduce the cost of care. A more coordinated and collaborative system will help us work towards our vision of healthy people, thriving communities. To this end, OCH and our sister organizations across the state are working with key state and federal funders and our local partners to establish a statewide network of community care hubs. A community care hub is a community-centered entity that supports a network of partners providing services and resources to address social needs. It centralizes administrative functions and infrastructure and has relationships with and understands the capacities of local organizations and fosters cross-sector collaboration. OCH will serve as the community care hub for the Olympic region, and we will call our hub Olympic Connect. Many of you have been working tirelessly over many years to support community members in addressing social needs, such as housing, transportation, healthy food, and more. So I acknowledge that the work you're doing to address social needs isn't new. Olympic Connect intends to create an aligned regional approach to how we address social needs. Our communities can't thrive if people don't have what they need for optimal health and well-being. Currently, you might see that our efforts to address social needs are largely siloed, and there isn't a system in place to track and address gaps in available resources. Organizations providing services often have to chase grants and may not have sustainable funding to meet the needs. We don't have systems in place to broadly track health outcomes to see how our efforts are paying off. Olympic Connect will bring the following to the region: funding to provide case management for social needs, funding to expand and enhance social needs resources and services, funding to build capacity and provide training for the community-based workforce, shared regional technology, including a regional resource directory, outreach, engagement, and communication in a variety of languages, formats, and mediums to connect people in various ways and to leverage trusted local messengers. Data analytics and reporting to better demonstrate regional gaps and challenges, as well as successes. And continuous improvement. We'll work to improve this over time. As I mentioned on the previous slide, Olympic Connect will include robust care coordination for individuals with social needs. Community members will complete an intake process and be connected with a community-based worker, like a care coordinator, community health worker, case manager, and other titles. And that person will walk hand in hand with them to address their social needs. OCH's current funding opportunity seeks to contract with partners throughout Clallam, Jefferson, and Kitsap counties who will provide the community-based care coordination services. This work is a marathon, not a sprint. We're intentionally taking time to listen, collaborate with local partners, and not get ahead of our funders. We know you're eager to learn more details on how this will all come together, and we're eager to share those with you as they're ready. We expect Olympic Connect to launch in early 2025. In September and through early 2025, we'll be working on robust community outreach and engagement to begin to spread the word. Initial funding opportunities to support this work will be announced throughout the fall. Stay tuned to OCH's upcoming newsletters, which is where funding opportunities, future convenings, and key updates will be shared. Beginning in September, we welcome the opportunity to come to your team meeting, coalition, or other group to share more about Olympic Connect. And if you have questions or just want to connect further, you can reach a team member via email at connect@olympic.ch.org. Washington State is a leader in this work, and we're all a part of building a new approach. I believe that a better system to care for people with social needs is possible, and that together we'll build a better future for our local communities. We truly are stronger together, and we look forward to working with you on our path forward.